All right. Hello, and thank you so much for joining us today. This is the third in the CIE's four-part series on understanding how student support services impact classroom teaching. And we really appreciate your time today. And we hope that you might be able to join us also for next week's conversation with the Student Ombuds Office on Monday, the 16th at noon. So that's next week, same time on Monday next week. Today, we're here to talk about and think about the when, why, and how to refer to counseling and psychological services. And it's my pleasure to welcome today's presenter, Dr. Mary Joy Swan. Thank you so much for joining us today.
Well, thank you so much for having me. It's a pleasure to be here. Again, I'm Mary Joyce Swan. You're welcome to use my first name in communication today. Mary Joyce, again, is my first name, and I use she, her pronouns. And I serve as the clinical director at Counseling and Psychological Services, which means that along with, the team, one of my aims in this position is to really kind of think about how we as a clinic serve students, how we think holistically about serving students. And certainly you all here today are part of that. So I really want to thank you for being here. And my hope today is to offer some practicality to try to answer some of these questions as to when, why, and how to refer. And I know that today I may just get kind of brief and give you a taste of some of these processes. And so I do welcome questions throughout. If you wouldn't mind helping me a lot with looking at the questions and paying attention to the chat, I'd appreciate that. And certainly if there is anything today that you are interested in learning more about, and I'll kind of mention that as we move along, I'd love to hear that, pass that along to our team so we can collaborate and potentially do some more detailed training in your departments and so forth. I wanted to start off by saying how I think one of the things that I enjoy about being at the university is this mission to treat students as a whole person holistically. And you all are part of that. I certainly feel part of the team here at SDSU. When we think about mental health, certainly there's a portion of that we're taking care of, but that work is done in so many different ways. There's so many puzzle pieces that all of you are contributing to really, again, treat students holistically, consider them as a whole person towards this mission of helping them to succeed at SDSU. So by looking not just at mental health, but basic needs, economic, housing, to think about them academically and what needs to be in place structurally. I think I really appreciate the approach that we as a university strive to take with our students. And I really want to name, as much as I'm going to be talking about mental health pieces today, you all are part of that equation. And certainly we appreciate that here at Counseling and Psych Services. I'm going to flip the script a little bit and actually start about why do we refer, or why might we even be on the lookout for mental health concerns with students? And this first reason hopefully does not sound too out of the blue for you. I think, how could mental health not be part of the student's experience, right? And so when we think about the student, and certainly we will talk about the individual student and the experiences that we see directly, I think it's so important for us to also think about our students holistically again, right? And I am going to borrow from Bronfenbrenner's ecological theories model. I think it's so helpful as an approach to kind of understanding not only upbringing, but our experiences in the world. So please know, I know this is an oversimplification of this model, but really the message here is that it's important to consider the systems in which our students live and how these systems contribute to those life experiences. So if we were to look at microsystem, mesosystem kind of experiences, we are talking about the tasks of managing lots and lots of relationships. So being at SDSU, not only trying to think about how to show up academically as a student, but also balancing the various pressures that come with being at SDSU, whether that's just being part of this community, being part of Greek life, being part of student organizations, and so forth. Outside of SDSU, we consider the different roles that our students have, and that's particularly the case for the students here at SDSU, where they are commuting from home and thereby really having to manage in the moment family pressures that come up, roles that they have as siblings, as children in their families, potentially caretakers, the roles that they have with their friends, different communities, such as their employment, the jobs that they hold, the religious communities that they're part of. And of course, we can expand this on and on. And I think by nature of being in community, having relations, that's just the nature of being human, we then are also vulnerable to the hurts and the harms that can come into it in the context of these relationships. And so here I've put relational trauma, which kind of is really an umbrella term, but this idea that, by nature, again, of being in these relationships, we are also at harm potentially to some of the ways that folks can unintentionally or maybe intentionally harm us as well. And so having to deal with the repercussions of that again as the individual. And expanding outward, if we were to go to what we would maybe consider a macro system, and certainly this is not an exhaustive list, but we're talking about race, ethnicity, gender, socioeconomic status, really the foundations of intersectionality, both the positives and how the joy of being in community based on identity, how that can contribute to mental health, but also the hurts that can come with that as well, particularly when we're thinking about systemic injustices and acts of hate. Certainly we're talking about political tension, climate crisis, human rights crises around the world. Again, this is not exhaustive. I think about lack of access to care, police brutality, stifling of voice through voter suppression laws, again, and unfortunately, we could go on and on and on, but these are part of, as systemic as these are experienced at the individual level, and these are what our students are going through. And it's really important for us to make sure that while we both are wanting to treat the individual and see and work with what's directly happening, that we're also paying attention to, importantly, the systems that they're in and the contextual factors that can complicate that. All right. Sorry, slides there. So coming back to the student, again, the message here is that we are working directly with students, and as just by nature of being human. And by the way, we could insert ourselves into the center of the circle too. I don't want to miss the opportunity to say that. But we are all human, and just by nature of existing, there's quite a bit of life to manage, and it's unreasonable to expect that none of this would affect our abilities to be the type of people that we want to be, in particular for students, that it wouldn't affect their ability to be the type of academic student that they want to be here at SDSU. And indeed, when we look at the data, what you're seeing here is in 2021, as part of a consortium of universities, an SDSU-wide survey was administered on health behaviors, health service utilization. So if you look just at the SDSU sample, we see that stress and anxiety rise to the top as two of the most reported barriers by students in terms of academic performance. And then there is a bit of an increase since 2018. Of course, a lot's happened since 2018. We had a pandemic, and so certainly we might see kind of the effects of that, as well as some, noticeable endorsement of depression, sleep difficulties, and death of a family member or someone close to them, also as potential barriers to academic performance. So again, the data confirms what we already know, is that whether directly mentioned to you in your academic roles or not mentioned to you, students are carrying quite a bit, and mental health concerns can indeed have an effect on their academic performance. Now, we could take this further, and I'm sure there are plenty of folks here who know the research even better than me, but when we're looking at mental health conditions such as anxiety, depression, that has impact on neuropsychological functioning, such as attention, memory, some executive functioning, thereby making it difficult to then tend to information, process information, commit to memory information, as simple as information that you have on your course syllabus, to a general handout that you have in your office, to the material that a student's being tested on. So again, it really is critical for us to look at mental health, to treat that not only for a human to human kind of purpose, but also because neurologically that can get in the way of students' abilities to perform the way that they want to. All right, I was just checking the chat to make sure I didn't miss something there. All right, so I want to briefly talk about when to refer, maybe some situations that you might consider bringing up counseling and psychological services or other mental health services. And so on one hand, I kind of want to say, well, from the beginning, I hope that you talk about counseling and psychological services in the spirit of normalizing that there's a lot more to life than just being a student, and that sometimes that can get in the way of being, again, the kind of student that you want to be, the kind of person that you want to be. So I kind of want to just start by saying, I hope that what folks consider here is just sharing counseling and psych services as a general resource, whether that shows up again in syllabus that you have or general resource materials that you generate. I think towards this idea of letting students know that you care about their well-being and their learning helps them to feel that they too can be more than just a student in your classroom, while also keeping true to the commitments that you're asking of them in the classroom. So again, I think there's a lot of power in normalizing, maybe like needing to check in with someone, needing a second perspective, having a rough day and needing to talk about it. The normalizing of that, there's a power that you all have and the positions that you hold here at the university to really make sure our conversations with students are starting with that important information, starting with that permission for them to seek support when it comes to, again, general challenges that might come up for them. And I wanted to take a moment to kind of come back to these macro system experiences, especially when it comes to race, ethnicity, gender, socioeconomic status, systemic injustices. I really wanted to take this moment to say how critical I think you all can be when, especially in conversation with a student, you find that a lot of the stress that they're experiencing is related to how the world just feels sometimes really hard to deal with. And I think when we're talking about these macro system stressors, the resolution, oftentimes in my eyes, is community, is company. And that's not reserved for mental health. That is, again, a human to human process. So sometimes I think when we're meeting with students and they are just feeling, with the state of the world, that they're feeling that distress, to be able to sit with them in that as a fellow human in the world is actually really important. So I really don't want to, again, miss this opportunity to emphasize how you all here can do that work. And sometimes that's where it needs to be. And that's all that needs to be said, is just to name, I get why you're feeling that way. I get that, today the world feels like it's a really hard place to live in. And we're in this together. And again, sometimes that intervention is just enough for a student. That being said, I know part of what is important here is to talk about the student individual experience. And so coming back to that, while on one hand, we want to talk about sharing counseling and psych services from the beginning and incorporating that as just a general resource that your students know about, I also want to talk about when students might be in distress and when this particular resource can be helpful. You all know, you are all kind of right there with students. When we think about distress, we can think about them in terms of emotional cues and behavioral cues. So I just wanted to take a moment here, if folks felt comfortable sharing in the chat, what are some of the ways you see students present as distress to you? And we will talk about behavioral, but if any emotional words come up, I'd love to hear that from you, and you can keep it in the chat to remain anonymous. I'm happy to read them out loud as well. So any emotional observations you make, emotional indicators, cues that you all might see for students. Anger, yeah. Concern about deadlines, crying in my office. You all are generating them because you know them, right? Depressed and suicidal, tense, touchy, covering their head with a hoodie, avoiding eye contact, withdrawn, not washing hair, not eating, not showing up to class. Thank you so much for sharing those. Again, I know you all are right there seeing these, and it gives me heart to hear you picking up on some of the even more subtle ways that students are showing distress. Again, it's not always verbal, but it's in the way that they appear. So I appreciate hearing that. And so I'll talk first about emotional cues that we might see. So some of the things we might see: crying, express sadness, increased irritability or anger. And importantly, the anger could be at outwards at you all, at the university, but could also be at themselves. We see anxiety. Oftentimes I hear students endorsing panic attacks. I have a little bit of a, I will say as a mental health clinician, a little bit of a reaction to that, because sometimes I think it's just kind of it can be an expected reaction to a situation, right? Rather than a panic attack and make it something psychological or clinical, it just might actually be a very expected reaction for the situation they're in, express negativity. That's also what we might see as well. And certainly we could cover other emotions here. And then behavioral, some of you talked about these in your responses, again, which I appreciate: withdrawal, avoidance, not going to class, not doing homework, decreased hygiene, self-care, talk of suicide, whether directly or indirectly, sometimes threats of violence, and otherwise avoiding responsibilities. So again, I sense from the group here, you all have an idea of what it means when, and you have that sense of when students are in distress. And so I want to kind of name that by saying that sometimes there's that gut feeling, that almost spidey sense that something is off. And so I think it's so important for you all to really think about tuning into that gut and acting on that. And I'll touch on this briefly. And if you're curious about this work a little bit more, we definitely have separate trainings on this. But anytime you do have that gut feeling and you're unsure, I just encourage you to ask directly. And so some examples of how that might look like is, I can tell that life has been really hard for you lately. What are you comfortable telling me about what's been happening for you? Or even if you're getting a sense of, is suicide showing up for this person? Has it gotten to a point at which you've had those thoughts about wanting to kill yourself? I really want to know. I really want to make sure that your safety is number one, and that that I can help in whatever way I can. So both tuning into the gut and asking directly so that you and the student are on the same page about where we can go. So certainly, again, counseling and psych services as a resource in general can be helpful. And also in particular, when we're talking about students in distress, we want to make sure that we are paying attention to those cues and really thinking about how to support students towards that next step of hopefully getting some support. Okay. So now when we talk about referring students, when I was thinking about going through this with all of you, I kind of broke it down into these two categories, and I hope that this is going to make sense. Let me start with the second one. There are certain mental health emergency situations, particularly related to safety of self, safety of others, where if we can kind of streamline the process and get that student some emergency support, I'm going to walk you through that, and hopefully that will make sense. For everything else, I'm basically terming as general. For everything else, this is how I might recommend making a referral to counseling and psychological services, okay? All right, so when we talk about making a general referral, when I think about referrals, what I always think about is aiming for packaging this referral in a way that it is not only heard, but followed through with, okay? So it might not make the most sense at the outset, but what I think is really important is to package this in a way, again, that it could be heard by the student, understood by the student, and ideally followed through with, okay? And so when we're thinking about this, I've as I was preparing today, I was thinking about the different ways I've talked with faculty and staff about students of concern and the different ways that they learn this information from students, whether that's in the classroom, via email, which is a really tough one to deal with because you're so distant from the student, email, after class chats, messages through the systems and so forth. What I want to kind of encourage first is to find opportunities to check in, and the more personal, the better. So if it is email, inviting that student, hey, I wanted to follow up with you about something you mentioned in your email. Would you be able to come in XYZ, Zoom, in person, whatever kind of works for you? Or finding time during office hours or after class to craft that time with that student. The more that you could do this follow through one-on-one in a space that might feel more safe to the student, I think the better. I do get a lot of kind of the concern comes up via email. And so, in an ideal world, we are inviting that student for, again, a more personal check-in, again, via phone, email, or in person, phone, virtual, or in person. And we can talk through some approaches via email, but this general idea of when you are noticing the concern, when you're feeling that concern, craft a time, arrange for a time to do a more personal check-in. In that check-in, I also encourage acknowledging your relationship. And yes, you have a relationship, even if it's a student that's enrolled in your class who you have never seen before. The formality of you as a professor, instructor, being assigned to the student, being listed on their schedule, you being assigned as a care coordinator on their Navigate My SDSU. The very nature of that, the formality of that creates a starting point. Even folks who are walking in to use a service, they have intention of connecting to someone, and that is a starting point. That is the starting point of a relationship. And so I really want to encourage folks to use this opportunity to, again, more personalize this referral that you're going to make, to personalize the care that you're going to express to a student. Again, at the outset of this, I said, what I'm really aiming for is how can we package this in a way that it could be heard from a student? And if they hear that you are owning a relationship that you have with them in the varying forms that it is, I think that that makes for an easier ask of a student. There's like a shared foundation. There's one more point that I was going to make about that. I also think too, when we are approaching students and sharing with them that we are concerned about not only their learning, but their well-being, it gives them, again, permission for them to be more than just the student in your classroom, to be the student who is also dealing with the mental health issues that they might be dealing with. And so if you can, within your own boundaries, show up as somebody who's not only that academic resource, but also a human, they too can do that. And I just think it makes for more open communication, and again, a more likelihood to follow through with a referral to counseling and psychological services. I also wanted to offer, again, an oversimplification, but almost a formula for you to think about how to express this to a student. And so often when I'm talking about how do you share with people concern, especially when there doesn't feel like there's a lot to work with, I think observing and expressing is the way to go. And so what I mean by that is observing potentially the emotion or the behavior that we talked about. Again, you all have talked about avoiding eye contact, wearing the hoodie, crying in the office, their expressed concerns about deadlines. So using the observations that you have and then expressing concern. So it might look like something like this. I noticed that you haven't been coming to class. I care about you. I care about your well-being. What's going on? And in kind of listening a little bit more, I wonder if it could be helpful to talk to someone a bit more. If you were to get an email and invite that student to come in, in your email, you shared some really concerning statements about your safety. And so number one, I really want to make sure you're safe. What is going on? And again, giving yourself and that student space to explore that a little bit more. But really, again, noticing, and I think it's okay to notice, like, hey, I've noticed that you've been coming with your, wearing a hoodie over your head in every class. What is going on? What are you comfortable telling me about what's going on? And really, again, using these observations so that we're staying neutral, but using that as openings to have conversation and to, again, within your boundaries, share how much you care about the student, their well-being, and that you want them to succeed in the class. Okay. I'm pausing for any questions or any, honestly, concerns. If anything I'm saying is also not feeling like that fits right or practical, I can, happy to hear that in the chat now, or wait for, would it be preferable to wait when it's not recorded? Sorry to ask.
It's quite all right. Absolutely. I mean, we have a couple of hands here, so why don't we go ahead and take those questions?
Sure.
And if necessary, we'll handle that on the back
Okay.
end in terms of editing out anything that's personal or private.
Sure. I see. Is it Arlette? You have a hand up.
Yeah, I was just putting it in the chat, but it's telling us easier.
Yeah.
So I'm just wondering, I can imagine that you see this behavior but you have a grand deadline coming up in 10 days, or you're really emotionally exhausted yourself, or you're about to go out of town for a 10-day conference, or so there's no way you can really check up within the next 2 weeks or so with these students. I mean, I know that I can make referrals in AAB. I'm also an advisor, but I mean, what do you suggest doing in these cases?
And when you yourself have stuff going on and it makes the timely follow-up really challenging. That's what I'm hearing. Yeah. A couple of initial thoughts. So I think about what's the baby step that needs to be done to set it in motion. I would not want any of you, again, I think it's so important, we'll touch on this. I would want you all to know what your personal boundaries are and logistically what boundaries are. And so within that, what's the baby step to kind of keep the ball rolling? Because ultimately what we want to do is we want to support students doing this and kind of advocating for themselves as well. And so it's a tricky situation, of course, case by case, but if there was like a tiny bit that felt like appropriate to do, like, hey, I want you to know about this referral. I want to check in on you in 2 weeks. Or if you had a team, right? A team that, hey, I really encourage you to make use of this resource. I'll have my teammate check in with you for a week. I wouldn't want you to feel alone in it. But yeah, it definitely has to be reasonable. But I think the ideal is, hey, we'll make this referral with the student and we'll continue to follow up with them. But that might not be reasonable for all the different demands that you all have. And so again, happy to problem solve this to a specific situation, but I would think like, what's the tiny step toward that? And again, how can we do that to help the student get the ball rolling? So those are some initial thoughts. I hope that gives you some things to think about.
Thank you.
Yeah, thank you. And I see a hand as well, if you're willing to share over the recording.
Yes, absolutely. I had a question about, you mentioned saying something like, has it gotten to a point where you've had thoughts of killing yourself?
Mhm.
And I'm wondering how, like, is it sort of a mandatory reporting situation like that you need to tell somebody? And do you need to tell the student that first before you ask a question like that?
Yeah, thank you. I did gloss over that. And so I'll take this opportunity to say we have some trainings that we've done for faculty. Our team has done something called I Can Help, or perhaps you've heard QPR. So these are some trainings where it's specifically around suicide and how to ask about that. And so I definitely glossed over that. So a couple of things. One is that there are several folks have duties to report up to supervisors or so forth. So I'll defer to your different departments on the procedures related to that. Where essentially they're just essentially either reporting up, but all towards this all towards making sure the student is getting the support that they need. And so sometimes what that can include, or that kind of disclaimer includes, is that if in the moment it's decided that an emergency resource is indicated, like police, we don't want that student to be surprised by that. And so that might be part of the disclosure. If I were to learn that you were in danger to yourself or to someone else, I might have to involve a third party like emergency resources to make sure you're getting that help. And so I think at the outset, if you get that, I mentioned kind of that gut feeling, that spidey sense, I think it's always, anytime you're getting that walking into a situation with a student, either you had that feeling with the student or you've gotten information from email that might suggest that might be part of the conversation. At the outset, as part of crafting a safe space, you are letting them know, here are the parameters essentially of this space. And here's how, for your safety, to make sure you're safe, we might involve folks. And so to be honest, I am not as clear on the mandated language that other departments have, so I'll defer to your departments on that piece. But I think letting students know other people may have to get involved to make sure you're safe at the outset is really important. Now, if you miss the cues, the gut cues, right, or you miss something and it just comes up, then take the moment to just say that. In the moment, it's going to be awkward. It's going to not be smooth, but seizing any moment that we have to make sure students know what comes with us being in this space, I think is really important. So did I answer your question?
I think so. Yeah, I just was wondering, the mandatory reporting thing, I think is mostly Title IX. But I just wondered if there was a correlation over to CNPS too.
No, not to us specifically, but I think it's primarily, again, if you all are going to involve emergency resource, that might be the case. Now, CSU employees are mandated reporters for child abuse. And so if that were to come up in the conversation, that would be something that would have to be reported to authorities. And again, that wouldn't come through necessarily with counseling and psych services. It might happen with police on their end and so forth. So anytime there's any condition or parameter to a conversation with a student, I think when you're talking about safety, knowledge helps them to feel safe, expectations help them to feel safe. And so that's really important. So such a good question. Thank you for letting me not gloss over it today.
Thank you.
Sure. Thank you so much for the questions and for folks' willingness to say those questions out loud. Okay, so you have talked to the student, you have observed what's been going on, you've shared your concerns, you've shared that it could be helpful. How do you make the referral? We'll get into that in a little bit, but I think these are kind of the goals that I might encourage. One type of referral is you simply get the commitment from the student to get help and they accept the help. And then you can, again, within your boundaries, help them to make those arrangements. So whether it is letting them know, hey, here's counseling and psychological services, here's how you connect with them. I'd love to follow up with you in like a day or so, a week or so. That to me, I think makes for an effective referral. So I do want you all to hear, you don't have to be there step by step with the student. I want you to respect your boundaries and figure out what works for you all. So one version, again, of making that referral is really getting that commitment, getting them to see that there could be a different way to handle this. Can you get connected to counseling and psych services? And I'll share with you some language to share with them as well. In any urgent situations, so by urgent, I mean if a student is sharing, some thoughts about not wanting to be around, maybe big thoughts of suicide, is really tearful, distressed, and doesn't seem responsive to any kind of intervention on your part. I want you to know that you do have the option to directly walk that student to counseling and psychological services. Of course, during business hours, you can also encourage the student to call us, and you can be on standby. I said on standby because you want to definitely default to what feels safe to the student, whether that's you being in the room with them, you being nearby, but you can help facilitate that. Again, kind of noticing your own boundaries with that type of referral, that type of action. I've been saying this all along is that, again, it's really important for you to check in with yourself about what your boundaries are. At the outset, I said how I'm really happy to get to work in this team. And so I really mean that, and that I want you to think about how do you do just the little bit of work and how do you be the first step towards getting them connected to us, like pass the baton to us, and we can kind of help them figure it out from there. And I also know that there's a tension that can happen. And I feel that too when I'm working with students and really wanting to help, but maybe like overly so in ways that might feel like I'm rescuing them. And ultimately what we're also trying to do is help them nurture self-advocacy, asking for what they need. And so kind of really watching that. So I will say one of the things I often hear from faculty and staff is that a student will tell them, well, counseling and psych services never got a hold of me or never left a message for me. They're busy, whatnot. I think anytime you hear that, I might encourage you towards this mission of not rescuing, but helping the student, encourage that student to give us a call. I want you to know, especially as clinical director, that's something that I keep my eye on a lot. And I will say that for the most, actually, I think 100% of the time, any initial contact we're turning around within 24 business hours, whether that's, a first attempt to contact students via phone, email, leaving a voicemail. So kind of just looking at our clinical flow this semester, we've continued to be able to do that. So it'd be really unusual if a student said, I've never heard from counseling and psych services, but not wanting to take away from their truth. I might just encourage them, hey, give them a call back. That's the type of stuff that they want to hear. If for whatever reason they didn't get a hold of you, they would want to know that. And so I really appreciate anything that you all can do to help students help themselves by reaching back out to us so that we can correct that perceived wrong and help them to see how we might be able to show up and support them. Okay, I do want to talk a bit about the second type of referral that I was referring to, and that's a mental health emergency. Now, ultimately, if you end up calling us a counseling and psychological services, we will walk you through the same procedure. But by mental health emergency, I'm really talking about a student who has plans or a desire to kill themselves or someone else, and they're not responsive to your care. They're not responsive to your recommendations. So this is a student who says, I don't care what you think. I have plans to do X, Y, Z, and I'm just going to do it. Or nope, I'm not safe. I'm not going to be safe. And it's just kind of really focused on the lack of safety. In this situation, I want you to know that you do have an option to contact emergency resources. Again, you can call counseling and psychological services as we can walk you through that. And anytime I think about a mental health emergency, I don't want time to be wasted. Time is of the essence. And so in these particular situations, this is when I would recommend contacting emergency resources. So one of the first emergency resources we have, of course, is a university dispatch. And at university dispatch, when you call them and let them know about a situation, they will help determine the next response. And so one of the options that you might have heard of is the Psychiatric Crisis and Support Team, which is called PCAS. It's a fully on-campus SDSU in-house service where it's a co-responder model where when there is a mental health emergency and dispatch learns of that, they consider sending both police officers, uniformed police officers, as well as a clinical team that comprises a licensed clinical social worker and another clinician. And so that is a response, again, particularly for mental health emergencies. Dispatch can send out the PCAS team. Dispatch can also determine if the countywide mobile response crisis team, oh my goodness, I just realized I wrote that, mobile crisis response team, that is what MCRT is, excuse me for that. They can determine if that team is indicated as well. They're similar in PCAST, but as county, there's just kind of different procedures that can happen and different kind of populations that can reach out to. And then of course, SDSU police is another response. And I will say working closely with our police, especially when it comes to sexual assault cases, I feel have been really responsive in the moment when needing to address. I see a question, is PCAS the SDSU version of PERT? Oh, kind of. They're very similar, but they can't do certain things. Like, for example, PERT can call an involuntary hospitalization. And so PCAS can't do that. Police can call for an involuntary hospitalization, but our members of PCAS cannot. Yeah, so there's some similarities and some differences, but I think the main thing I want folks to know is that for mental health emergencies, a clinician can come and kind of assess the situation and even do follow-up. So happy to think about that more and how I might want to delineate that a little bit, but that's one, that is one distinction I'm making. And I just see in the chat, is the dispatch number the same as the non-emergency number? That's correct. That is the non-emergency number. Yeah. Thank you for appreciating my clarification as much as I could get it for PCAS. And PCAS actually comes out of counseling and psychological services. And so I know they've just launched August 1st. And so they're doing a lot of that work and meeting with different departments. So please be on the lookout for them, or if you're interested in them, happy to pass that message along. I want you to also know about some other emergency resources. So our line, which is our main line, 594-5220, it converts to an after hours line that are staffed by folks trained in crisis intervention. And that automatically turns on after hours 4:30 until 8 o'clock when we start the business day, and it's available on weekends. When students or anybody makes a contact to that line, we then get a report at Counseling and Psychological Services if follow-up is requested. So we do follow up with those inquiries on the after hours line. There's also the 24/7 access and crisis line for San Diego County. I think it's a great number, 724-7240, because it's 7 days, 24 hours, 7 days, 24 hours, really easy to remember. And then of course the 988 number, national number that they launched a year ago or so, which I think ultimately goes to our county line. And then just as another resource is the crisis text line. So you simply text anything, you can text help or home to 741-741 to reach somebody also trained in crisis intervention. So those are some emergency resources to consider if and when you're in an emergency situation and like immediate response is critical. Again, you can call us, it adds to the process, but in your heart, if you know that this is one that requires immediate intervention in this way, then I don't want you to hesitate to contact some emergency resources. Okay, so we've talked about why refer. We've talked about some occasions to think about when referring and even how to refer. I want to tell you a little bit about counseling and psychological services when that referral comes to our end, how that goes, okay? And so first of all, take a moment here to pause and just say that this is our contact information. I know you know how to find this on Google, but I'm going to just put it here anyway. Phone and email, as well as our website. That QR code goes to our website. And we do have a page that I'm really proud of that says Get Started on our page. And I think it's a great spot for students to explore, to get to know this process. So that's my hope of in terms of our presentation today. Then I'm going to walk you through that process a little bit. So here's what happens. So for the majority of students, and also I'll say faculty and staff, as well as parents and families and other members such as alumni, on occasion, just somebody who lives in San Diego, for the majority of folks, their first contact they're going to have with counseling and psychological services is through our phone consultation process. And that's simply with the volume of students and volume of inquiries that we get, to be able to turn that around in a 24-hour period. We use this model to essentially triage, hear what's going on for a student, and from there figure out, well, where do we go from here? Now, I do these calls along with my teammates here. Again, it's about a 5 to 10 minute phone call, and it's our opportunity to hear that caller's concerns and really from there make this personalized recommendation about what makes sense for their unique situation, whether that is getting connected to services at our center in-house, whether that's something that's off campus that makes more sense. I often tell students too, sometimes the phone call feels like enough of a first step, and that's okay too. But they don't need to come knowing what they need. They don't need to come explaining what's going on. It's our job. We are trained to elicit that and to also assess for safety and again, help them to figure out that fit. So if you feel like students haven't heard from us, if they've been referred to us and they haven't gotten this phone call, I would be really surprised. And again, really just ask for your support in encouraging students to call us back so that we can go through that process. There are certain situations too, when we're on the phone, if we were to hear certain situations, we will offer something in person. We will offer them to come in so we could do the version of this in person. If that increases comfort, it increases our ability to assess what's going on. So those are in play as well. When our faculty and staff call, which you all are welcome to do, the process is pretty similar. We'll hear your concerns about a student, and because we're confidential, we cannot confirm nor deny any history with a student, but we can walk you through your situation and help figure out what's a response that's going to make sense for you. And so that's why I said earlier, I do want you to hear you do have a relationship, even though I know it doesn't feel that way. But for students, they do perceive relationships with faculty, staff, and all of us here. And so how do we use that connection to share concern and share and really help them to get the type of help that they need? Again, from the phone consultation, some of the things that can happen is we might consider a referral to some of the services we have here. So that can include individual therapy and group therapy, which I'll go over a couple services that we have as well. We have couples therapy as well. For any students who might benefit from something not that's outside of what we offer here at Counseling and Psych Services, in particular, potentially longer term therapy in the community. If we're not able to provide the therapy directly to them, we will provide what we call clinical case management. And the whole task of clinical case management is to help them find that provider in the community that they want in the long run and stick with them till they find that person. So again, if our in-house services don't really make sense for what they're searching, we change up how we show up, and we show up and help them to find that in the community, because we know that we may not be the final destination for a lot of students. So I just wanted to share with you a few services that we have. This is just a smattering of some of the groups that we have, whether that's identity-based. So we have Epiphany, which is a workshop space that we do for AAPI students. We also have En Confianza that we do in collaboration with the Latinx Resource Center. We have spaces for folks who are dealing with body image issues or problematic eating behaviors. I run a group called RISE, which is our support space for survivors of sexual violence. We just launched a group for undocumented students through the Undocumented Resource Center. And we also have a space for grad students and trying to get them graduated and out. So a whole host of things that we offer. Groups is a really great way for folks to not feel alone in their healing, in their recovery. And so I definitely want to recommend groups. And this is part of when I'm talking to a student, I'm having conversations to think about these particular referrals and if it makes sense for their particular situation. We also have a drop-in space called Talk It Out. So this is not therapy, but if someone just needs a second perspective, they just need, again, to talk out something, maybe get some tips. We have a different Talk It Out spaces, both virtual and in person, where a student can get 15 to 20 minutes with one of our counselors here and just get that, space to think through an issue. And if further services are needed, they can talk about that there as well. Wanted to highlight our Center for Wellbeing, which is a drop-in space that we have, and folks can just come, really just kind of get away from the hustle and bustle of SDSU. And sometimes that is the intervention, that's the level that a student wants to make some change in their life. And so just to kind of escape and get reprieve, that's there as well. And I cannot do any presentation without making sure I mention our star staff members here, Baxter and Luna. Therapy dogs. Baxter is a little bit not on hiatus, but kind of taking a break. He's a little bit older in age, but Luna is up and at 'em, and so Luna has office hours. I think Luna does something at the pond every week, some work with the Pride Center. So all of this is to say, follow them on Instagram. I think they have a ton more followers than I would ever want myself. But go to that and get some information about them. And of course, for students, sometimes, again, in asking, sometimes you'll learn that they just miss their dog. They miss being like the human to their dog, and so, or pet. And so if that's the way we intervene and show up for them and help them, again, be the student that they want to be, then that's how we'll show up. So, and then I do want to mention too that there's a collaboration to create this basic needs and wellness toolkit that is housed at this link right here. You can do a Google search and find this as well. And this, I think, is really tailored to faculty and staff and helps you to think about when you encounter certain situations, here's kind of steps to consider in terms of intervening. Okay. So that is just a quick tour, really, of counseling and psychological services and related processes. If you're interested in learning more details, please let us know. You can reach out through our website. We have an option to request outreaches and presentations if that's of interest to you. Happy to hang back too and hear of any inquiries, but just really want to thank you all for your time, all the work that you do. Because you are there working with students, and I don't want you to ignore the power that you all have to make these types of changes to have the positive impact on the mental health of our students. So again, I'm just so grateful to all of you for choosing to be here and again, doing what you do. So thank you so much.